So welcome back everybody, this is the final video in this series looking at otitis, and in this video we're going to be looking at a case example to hopefully put together all the things we've talked about. So I'd like to introduce you to Roxi. She is the lovely spaniel on the right hand side in this photo, and that's her brother Bailey sat to her left, or her right. Roxi was a 4-year-old Sprocker Spaniel. She came to see me, she'd had recurrent problems for the last couple of years, and her owners described these cycles of ear flare-ups, often malaesthesia that resolve with Surolan. They'd be okay again for a little while and then they'd flare up, and more recently rods had been identified and Pseudomonas found on culture. She was described as being completely well in herself. She had no history of travel abroad, and she was up to date with parasite treatment. She was taking NexGard Spectra every month. Okay, so let's talk about the clinical exam for Roxi. So general clinical exam was completely unremarkable. She was well in herself with no problems. Her right ear was really pink and settled with no issues. Her left ear was the problem, and it was very inflamed with marked stenosis of the canal. It was red, it was smelly, there was a lot of purulent discharge. She had a little bit of inflammation and redness between the pads, so the underside of her feet, but her interdigital spaces, nails and pads were unaffected. Her axilla and cranial abdomen were completely unaffected, and her coat was in really good condition. We didn't get a positive itch scratch response elicited, but she did scratch throughout the consult. Okay, so we can see on the left we've got a picture of Roxi's ear, which was very stenotic. It was really hard to see the canal itself. We can see there's a lot of discharge there, it's very red. She was really uncomfortable, bless her, with examination. And then just a little bit of redness of the foot, quite mild. So we took some cytology samples. You can see from her foot there was a little bit of malaesthesia, possibly a little bit increased, but no white blood cells, no bacteria. But we can see a very different picture in her ear. So that was from her left ear. We can see we've got malaesthesia, not a lot, but there are some floating around, and mainly rods with some cocci. And so our initial treatment plan. So because Roxi had had this very chronic history of otitis, we booked her in for a head CT and an ear flush to make sure that her middle ear was okay. And in the meantime, because that was booked for a week's time, we started some treatment. So we got her on some Pardel. We went for 15 mg/kg twice a day. We started her on some prednisolone, which worked out for her as 0.6 mg/kg once a day. We started some Otitis, and we asked the owner to apply it to the cotton wool pad and wipe the ear out, so we didn't make the ear very wet. And then we actually started some Arising. Now Arising contains marbofloxacin. It is licensed for use in ears, and it is fine if the eardrum's not intact. So actually this is a reasonable first line in this case. So we then saw Roxi back a week later for her planned procedure. She'd remained really well in herself and tolerated her medication well. Her owner reported she hadn't been enjoying the ear treatment but was being a good girl for it, and she'd had no marked side effects from the prednisolone, just a little increase in thirst. The owner reported the ears were a lot more comfortable. And so this is a photo we actually took before her flush, so when she was under anaesthetic, and we can see already there's a really marked difference there. I popped the date stamps on there so we can see. We have that original really horrible ear, and then just a week, maybe 8 days further on, we've had some steroids, we've had some pain relief, we've started some treatment, and we can see that this ear is already much better. The canal is more open, the redness has gone down, it's less stenotic, so this is a really good example of addressing our perpetuating changes. So then we had Roxi in for her procedure. She had a head CT, and this revealed no evidence of middle ear disease, which was great news. We flushed her ear, her left ear. We checked the right first, and it was normal, as we'd found originally. And the left ear was already looking quite pink and settled, with only very minimal discharge. We did find a low volume of rods and malaesthesia, but no cocci or white blood cells in cytology, so again an improved picture. And we discharged her with instructions to continue with her current treatment regime, with a review 2 to 3 weeks later. And we also reduced, the only change to her treatment regime was to taper the steroids there to every other day. And here are some images from her ear flush. So we can see on the left there, that ear canal is looking lovely and pink. There's a little ceremonous gland hyperplasia. We can see the very subtle cobblestone appearance, but loads better, and a little bit of redness at the bottom. And we can actually see a lovely, beautiful eardrum there. There's a little bit of discharge and hair, but actually all intact, which was nice. And then we saw Roxi 3 weeks later, and her owner was delighted to report she was completely back to her normal self. There was no head shaking or scratching. Her ear looked beautiful and the cytology was normal. So then we went on to our maintenance step, which we've talked quite a lot about. We started some cortotic, so 2 pumps into that ear twice a week. And actually the update we've had from Roxi's mum is that she's continuing to do really well, and she's reduced it to once a week now. So that's the end of this video and the series, guys. Thank you so much for listening. If I could encourage you all to like and subscribe to the Langford Academy YouTube channel, we'd really appreciate it. And stay tuned because we're going to have loads more videos coming out soon. Right, thank you for watching, everybody.